How do cognitive test results show cognitive decline? Imagine trying to solve a puzzle or remember a list of words. When someone takes a cognitive test, they're doing similar mental tasks that measure different parts of their thinking. These tests help doctors see how well the brain is working compared to what's normal for a person's age and education. If the scores are lower than expected, it might mean there is some level of cognitive decline. This decline can be linked to conditions like dementia, but it's important to remember that one test alone doesn't give a full diagnosis. It's just a piece of the puzzle that suggests further evaluation is needed. One common test used is the Montreal Cognitive Assessment, or MoCA. It scores from 0 to 30 points. A score below 26 can suggest mild cognitive impairment, which means some mental functions are weaker than they should be. The MoCA looks at many areas like memory, attention, language, and problem solving. If someone scores between 18 and 25, it might mean mild issues. Scores between 10 and 17 suggest moderate problems, and below 10 could indicate more severe impairment. The MoCA only takes about 10 minutes to do, making it a quick way to catch early signs of trouble. Another widely used test is the Mini Mental State Examination, or MMSE. It also scores up to 30 points and checks things like orientation to time and place, memory recall, attention, and visual spatial skills. While it's helpful, it's less sensitive than the MoCA for detecting mild problems. Then there's the Mini Cog, which combines a simple memory test with a clock-drawing task. If the scores are below certain cutoffs, it suggests dementia might be present, but a normal score doesn't completely rule out early stages of cognitive decline. There's also the self-administered Gerocognitive Exam, or SAGE. It's a brief test that people can do on their own to spot early signs of cognitive issues. When test results show impairment, it indicates that some mental functions are not performing at the expected level. This doesn't mean a person definitely has dementia, but it does mean they should see a healthcare professional for more detailed testing. These might include neuropsychological assessments, physical exams, or brain scans. It's important to remember that a single test isn't enough to make a diagnosis. Sometimes, people with early symptoms might still score within the normal range. That's why doctors look at the whole picture, including medical history and other signs. In the end, cognitive test results show decline by revealing how well or poorly someone performs on mental tasks compared to typical scores for their age. When scores are low, it suggests there could be some level of impairment, guiding doctors to take the next steps in diagnosis and care. These tests are valuable tools in catching early signs of dementia and helping plan appropriate support and treatment. Always consult a healthcare professional for personalized advice and further evaluation.